I'm Rob Allen from RangeMaster Shoulder Therapy, and we make shoulder therapy tools. And today we have Jennifer Williams with us. And
Hi.
Jennifer is recovering from a shoulder surgery and probably be interesting for everybody to know she also runs a dog rescue. So we hear countless stories of people who injured their shoulder walking a dog, either falling,
Walking a dog.
tripping, or something like that. So Jennifer, tell us, where are you located?
I'm in Chino, California. That's in Southern California.
So are you closer to Los Angeles or San Diego?
Closer to Los Angeles. On a good day when there's no traffic, it's 40 minutes to get to LA. But 4 hours. It can be 4 hours in the morning.
Well, thanks for joining us, and tell us a little bit about how you hurt your shoulder.
Well, I probably originally stressed my shoulder when I was walking 3 of my dogs and they decided to chase after a cat.
Yeah.
All 3 of them ran the same direction and they were all in one hand. And that stressed my shoulder, and I had, but nothing where I needed surgery. I did some therapy and got over it. But then 3 years and 2 months ago, I got rear-ended with that, and the seat belt, I was the driver, so it was my left shoulder. And I hit the seat belt so hard because I was on a stop and go on the freeway. I don't even know how hard they hit me. But that was the worst pain. My shoulder, it literally, my whole, everything from, all across my whole trunk hurt really bad, but my shoulder got really injured. I couldn't move. And I would tell everybody, I run a rescue. So I've got a lot of people that I see on a regular basis, and they'd walk up and want to hug me. Get away from my left side because I'm going to punch you. It was really bad.
Did you go to the ER?
I did, but that first day when you go to the ER, they're like checking your neck to see if your neck's okay.
Yeah.
And my neck was, by all accounts, it was fine. And it was more of a progression of, as the inflammation and as it became really apparent that it was much worse than just a little bump or a little bit of a strain. I couldn't use my arm at all. And it took, because I went to a pain specialist or an accident type doctor, and they did MRIs of my neck and my back. And I'm like, but that's not where, that's kind of hurting, but let's triage this. My shoulder is the thing that's really bad here. And it took months, about 5 months before they finally did an MRI. And that's when they realized, and they scheduled me for surgery right away.
Wow, 5 months is a long time to wait. Were you icing? What were you doing for pain?
I didn't realize I was icing a little bit. I take CBD because I'm allergic to NSAIDs. Mm-hmm. And that helped enough, but not enough to be like, okay, well, I can live my life this way. It wasn't enough.
Okay. Did you try any creams or ointments, or were you just ingesting for the CBD?
I used CBD, like the rubs, the salves and things like that. And then I also have a friend that has a cold laser.
Oh, yeah.
Yeah. He was spending so much on his dogs doing cold laser that he went ahead and bought one. So I used that several times, and that definitely helped with inflammation, but it wouldn't stay gone. It was just like taking an Advil, and pretty soon you got to take another one, but
that's right.
Right. So that's kind of, there was no way. No way.
I would tell me a little more about this journey. At any point prior to your surgery, did anyone give you a sling to just try to immobilize your shoulder?
No.
Okay. All right. So you're going along at 5 months. You finally talk them into doing an MRI. What did they see?
full thickness tear of the,
Supraspinatus?
I think that's the one, the rotator cuff.
Yeah.
And then I had a tear that went along the same direction as the labrum.
Okay.
And I had all kinds of swelling, and there was like 7 things on the MRI that they said they needed to correct.
And then they immediately scheduled you for surgery.
Yeah.
Well, if you're that far in, oftentimes the surgeon's concerned about the integrity of the tissue because it starts to atrophy.
Sure, that makes sense.
And it doesn't have as good of stability if he's going to try to suture it back up. So he wants to get as healthy a tissue as he can to work with. And frankly, 5 months is a long wait for that kind of thing. It's one of the dilemmas where there are waiting lists is what's going to happen to the integrity of their.
Right, because even when I talked him into doing this surgery, he went on vacation for a month.
Well, I'm not going to go there with you because he might be watching.
Let's not.
Yeah. All right. Did you use a shoulder specialist, or was it an orthopedist that was a general orthopedist?
He is the doctor that the attorney sent me to. He was, I think he does all kinds of stuff.
Yeah.
Orthopedic.
Yeah. And did you do it in a local hospital or an outpatient clinic?
It was a surgery center.
A surgery center out there in Chino, or
no, in Orange. I think that my surgeon or his group owned that particular clinic.
Yeah. That's
something like that.
Yeah, that's not uncommon, particularly if they start specializing. They'll want all the right tools and a staff that's not their first rodeo. So you come out of surgery. I'll bet you came out, and when you woke up, you probably were in a sling or a pillowed sling. Yeah. And they probably gave you fairly strong painkillers.
Actually, I refused all of that because of my allergies. And I found out in the middle of the night that night, because they send you home right after surgery as soon as you can stand up and not vomit, they send you home. So and I had told him, I don't want any of your drugs. So anyway, he put this thing, there was like a straw type thing in my shoulder.
Yes.
Right? I don't know what it was. I don't remember the name of the medicine that was in it.
Yeah.
But I felt like I was going to have a stroke in the middle of the night. I'm really sensitive to medications. And I was awake and nobody else in my family, and I don't want to wake anybody up. So I was like, as soon as somebody woke up, I said, you have to take me back today because I have to get this thing out. Because I almost took it out myself, but I couldn't see, to see, was it, something that I could just pull out or not.
Yeah. Probably a port. It was probably a port so that they could do a block, some sort of a pain block if it got too bad.
Right. I'm just way too sensitive to medication.
Yeah.
So I made it through that recovery on ice and CBD and nothing else.
You should be congratulated, because that's a rough first 2 weeks.
That was a rough several months.
Well,
I mean, I would wake up in the morning and I can't tell you how much ice we bought.
Sure.
And I had a nice machine in my car too, so that when I had to go to work, once I started driving, I would still be driving down the road with ice on my shoulder, because you can't take CBD. I can't take CBD and drive because I get too relaxed. And I would, I guess I'd technically be a drunk driver if I was. So I had to make it through on CBD or on the ice.
On the ice.
I went through a lot of ice.
Did you get a pump then that did circulating cold water? Is that when you said?
Yeah, I had one. I have 2 of those machines. With the little cooler with the little thing that looks like a heating pad.
Yeah.
Oh, I love that thing. Love that thing.
And then after generally about 6 weeks, the doctor will send you to a physical therapist or an
Nope,
occupation. No,
nope, not much. Little
didn't.
bit.
What about movement? When could you start moving?
Um, you know what? I'm lying. I went to a therapist for a little while, but it was like the same one that I'd gone to that said, yeah, I probably need that shoulder, more for my shoulder. And I went to a few of the things, but um it really, yeah, I guess it was 6 or 8 weeks, and I started doing a few things and like sitting in the pool and floating my arm because they said I couldn't move it
Mhm.
in the pool, no swimming, no none of that. Um, and then I just kind of started doing some of the stuff that they had showed me at home because the place they sent me was so far away. It was almost an hour drive away and it wasn't convenient. So maybe my recovery probably took a little longer than some people because I wasn't willing to go there and drive that far just for therapy. Not something that I could do the finger ladder by myself at home.
Yeah,
And my husband rigged up a thing so I could do the pulleys in the
right.
garage. I was doing pulleys, finger ladder, and then I would go to the pool and float my arm.
So you designed your own recovery program.
Yeah, I did.
And
Hmm.
did you get your full range of motion back?
I have it now.
How long?
It
How
took
long?
18 months.
Took 18 months, but you got it
Yeah.
back.
Yeah.
Well,
But I'm a
congratulations.
type A personality, so I'm not going to let something like that get me down.
Well, that's great. And so tell me about we make pulleys. I think Camille may have told you, or my associate. We help about 200,000 patients a year with pulleys and stretching and little strengthening tools for the minor muscles of the rotator cuff. So
Okay.
your husband made you a pulley. What did it tell us about that?
It looks an awful lot like because I saw a video of what you guys do. And I sent her a message. I said, that's so funny you know, that I would talk to you because my husband made something very similar. My husband's an engineer. So,
Oh, yeah.
I said, hey, I need something that'll help me because he wouldn't do it. He wouldn't be my physical therapist. He was afraid he would hurt me.
Yeah. Yeah.
Right.
Yeah.
So I would tell him, could you just grab my arm and pull it up? Because it's miserable. I want to sleep with my arm over my head like this.
Oh, yeah. And that'll create a
Right.
vision. Yeah.
And I couldn't, or I would have to get my other arm to do it for me. So I said, I need you to do this for me. And he wouldn't. So that's when he decided he'd rig up the pulley system for me. And then he would call me and he would say, are you using that pulley thing that I made? Are you out there working out?
That's
So
good.
he wanted me to get my range of motion too, because, to be with someone that can't even carry a glass of water or a bottle of water out, if you go somewhere to eat,
Yeah.
whatever, and you're carrying it to your table, I couldn't carry anything. He had to do everything for me. So,
Well, you've kind of self-designed a program that worked for you. I think that's
yeah.
amazing. That's amazing.
So one more thing I probably should tell you is that I have Ehlers-Danlos syndrome. Are you familiar with that?
I'm not. Go ahead and
It's a
explain.
hypermobility problem and it's connective tissue.
Yes.
Okay. So that's probably why I got hurt so bad with a minor, rear end. Okay. And I was just recently diagnosed. I think that's why it took me so long to get my range of motion, but it also makes sense that I have incredible range of motion for my age and for my illness,
Yeah.
because we're like those circus act people, that have like backwards knees, backwards elbows. My jaw clicks in and out as I eat. It's just kind of normal behavior for my body to do that. So for me to have really good range of motion in my shoulder, this is the one that I had surgery on.
Yeah.
And it doesn't hurt. It clicks a little bit, but I sublux everywhere. my jaw, like I said, my jaw sublux, my thumbs, my hips, my knees, most of my major joints sublux.
So you've
So,
already you got a fallback career if you ever want
right, I could join the circus.
to. Yeah. Well, this is a fun story, and I can see now why Camille picked you out, because you've done, generally what we would expect is immediately following an accident, you'd be immobilized, and then you'd be using ice and other painkillers. And then they would try range of motion work on you in physical therapy, because movement creates circulation and that starts the blood flow, as well as distributes the synovial fluid that oils the joint. But if
Right.
there's if there's mechanical problems as a result of your accident, then you go to surgery, and then you kind of go back to square one and act as if you just got in an accident again. And they immobilize you and give you the painkiller or ice. And then in about 6 weeks, they start your movement again. And then it's a matter of moving, stretching, because scar tissue can form and keep you from having full range. And then eventually strengthening, because those supraspinatus and infraspinatus muscles that make up the rotator cuff are very small, and oftentimes you get help from the major muscle groups. There's 17 muscles affects the shoulder, but
Right.
those all need really light, repetitive exercise. But I would guess from your occupation, you're getting plenty of little pulls and restraints and things.
You mean like lifting 40-pound bags of dog food?
No, you shouldn't be. You shouldn't be doing that too soon. Eventually.
I know my staff was constantly yelling at me, would you stop doing that? Quit pushing furniture around, things
Yeah.
like that. But why? As long as I can still move my hands and arms, I'm going to do it.
Yeah. Yeah.
Probably affected how long it took my recovery.
How's your posture?
Oh, well, again, I'm hypermobile. It's terrible. It's terrible. I'm going through physical therapy right now to kind of help clean that up. My pelvis I have that anterior pelvis tilt.
Yeah, pelvic tilt.
So having knees that are hypermobile can cause all of that. The anterior, because if your feet aren't working right, if they're tilting off to the side, which my ankles, I can sprain my ankle just by walking down the sidewalk. Okay. Right. So, and I just thought I was weird. I mean, I literally got diagnosed 9 weeks ago. So, but then, so your feet are off, it messes up your ankles, messes up your knees, then your pelvis overcompensates because the knees are flexing the wrong way. And then my back, I have low back pain, and then all the way up, because then, like I said, I had to have the decompression of my brain because my brain was slipping down into my neck. And all of that is posture and hypermobility related, all of it.
Well, why don't I'll ask Camille to mail you a little product we made for free for joining us today. It's called the Posture PT. It's a piece of TheraBand and a door anchor and 3 or 4 little posture exercises that you can do.
Okay.
And promise me that you'll show it to your healthcare provider, because I don't want you doing anything that would compromise what they're working on.
I'm going to tell you real quickly about a book that PT called, his name is Kevin Muldowney. He wrote it, something about, I can't remember another thing with my brain, names exactly, but it's something about how to live your best life with Ehlers-Danlos syndrome. And the level, I'm on level 0.5. 0.5. I'm not even on number 1 yet. And it's just isometrics, tightening the muscles in the core. And I'm going to follow this program. I'm going to do it for a year, like they say. And if I'm strong enough to, like, every single time open a water bottle by myself, I'm going to be praising hallelujah, you know, I'll be 55 and I'll be able to open a bottle finally. So it's kind of exciting, and I will show it to my PT person. I'm going to start seeing them on a weekly basis. I think they make you do a month on 0.5 before you're allowed to come back and start on 1. But I'll show them that and see if they're interested in hearing more about it. And you know, I'm always interested in anything that'll help me start to feel better, because I know it sounds like it's great to be able to do circus tricks, but
No.
when your joints are constantly subluxing,
No.
it's painful. It
Yeah.
causes a lot of inflammation, and having the brain slip down just because you're probably my jaw and my skull were subluxing and allowed that to happen. That wasn't any fun. That the recovery was a lot quicker than the shoulder.
Yeah. Yeah. That shoulder recovery is tough.
It's awful. I hope to God I'm never in an accident where I'm on the passenger seat.
Yeah. What do you tell people, Jennifer, that have shoulder injuries because they know you've had one? Do you have any general advice you give them?
Well, I talk about the ice. I talk about that. I don't want to influence anybody on getting that shoulder surgery, because I know I'm not a huge fan. Yeah, it gave me my life back as far as being able to, you know, let people hug me. Although it
Yeah.
started feeling good right about the time when the pandemic started. So I don't want anybody hugging me now either.
Well, and what about, do you recommend people use topical CBD for the at least intermediate relief that you were able to get?
I talk about, well, I'm more of a proponent of CBD in general, whatever, any way you can take it, because it's a great anti-inflammatory.
Mhm.
It made a huge difference in how much asthma medication I need too, because the inflammation in my lungs is down. I have hardly any inflammation anywhere because of the CBD, which is a huge benefit. You know, I tell people, if you can avoid the surgery at all, you know, avoid it. But I have a friend that just had it 2 weeks ago, and she's still, my husband used to say, why are you acting so gimpy? Because I'd walk with my fingers in my pocket, you know, to kind of release the pressure, I think.
Yeah.
And she's not even doing it for that. She's missing some feeling in her hand.
Yeah.
And she doesn't run a dog rescue, but she does a lot of street rescue, going out and finding the dogs out that are dumped out in the desert and stuff. So, I mean, she's a really much needed force out there. I want her to get her range of motion back and get the feeling in her hand back as soon as she can. So I kind of knew it was on the horizon, but I don't know if there's any other way around it. You know, when you have a full thickness tear, will that tissue ever grow back without medical intervention? I don't know.
Well,
the jury is kind of out, I think.
Yeah, the medical evidence says it can, and then it depends on if it's atrophied and pulled completely back. You know, if it's a horizontal tear, or if it's just a kind of a split in the fabric to split open that way, as opposed to like when your Achilles tendon ruptures, they just separate.
Right.
But a full thickness tear generally is all the fibers are running this way. I've heard it described as having a hole in your sock. You know, the hole's in the wrong place. Your shoulder humeral head will pop out, and then it gets an unstable joint, and that'll really cause you.
Wow, that's really scary to think that something like that could have happened. But every day I'm just thankful that the doctor, he did do a good job. He didn't listen when I said I didn't want that other pain medication, but other than that, he did a great job of fixing my shoulder. And like I said, range of motion is great. I can carry. I'm really conscious. I know I shouldn't be carrying 4 and 5 bags of groceries in that hand, but everything should be healed up by now. It's 2 years post-op.
Yep. Jennifer Williams, thank you for joining us today. And what a great story, and keep up the good work with the animal rescue.
Thank you so much.